So some men get an enlarged prostate. When the prostate enlarges, it can block the way out. So the urethra is the tube that leaves the urine from the bladder. So your bladder stores the urine, and the prostate, is just a gateway to let the urine leave. So prostate sits right here. As you get older, it gets enlarged. You get what's called benign prostatic hyperplasia, but the prostate gets enlarged. So when you have an enlarged prostate, right, it can cause issues with urinating, right? And when that happens, you have trouble with getting the flow out. So just looking at the prostate, looking at the bladder, right, you're gonna have issues with flow. So what we can do is a procedure called Urolift. And essentially what you do is, the prostate's kind of grown. And so if you take a look here, you can see that the two lobes of the prostate have grown together. We put a camera inside the bladder or in the prostate, and we compress the lobes open. And while we're compressing the lobes open, we fire a little stapler. And this little staple sits inside the prostate and holds the channel open. So as you've gotten older, the lobes have grown apart. We're just holding the lobes open for you. Now, it's a minimally invasive way that's reversible that will allow you to urinate better. The procedure itself, takes only a few minutes. We leave a catheter in between 6 to 12 hours after the operation itself is over, and you get recovery shortly afterwards. We give you some antibiotics and some pain meds and some anti-inflammatories to help you after the surgery. Most guys tolerate this really, really well, and I think it's a lot better than trying pills, which have a lot of side effects, especially some of the ones that can affect ejaculation and make you dizzy. This is a nice procedure. It's definitely a first-line therapy. It's one that I look towards because A, it's reversible, B, it won't mess your ejaculations, and C, it's outpatient and quick.